And that's good news, because the more effective we can be in this area, the quicker we can get everyone back to work. But we still have a lot more work to do, and that's the reason why our health officer extended the order to May 31st. As you may be aware, Contra Costa County and 5 other Bay Area counties was the first place in the United States that initiated a shelter-in-place order. And that was because our health officers were all seeing concern about very fast community spread of this virus, and that this action, very extreme for all of us, needed to occur to slow the spread. We also know that many people are experiencing financial hardship as a result, and that will continue and could get worse the longer this goes on. And I'll talk a bit about some of the actions we've taken to try to help those who are financially suffering. So where are we in terms of cases and hospitalizations? So right now, there are 891 positive cases in Contra Costa County. Of those, 111 cases in Richmond. So Richmond's about 10% of our county's population and about 12% of the number of cases. So we are not seeing a higher number or percentage of cases in Richmond as we are in other parts of the county. In fact, some of the areas hardest hit are communities like Orinda, where there was an outbreak at a senior facility. There's been about 13,000 tests conducted in the county. So there's been about, so far, a 7% positive rate of those tests. There's around 300 to 400 tests a day that are occurring in the county, and our health officer believes that we need to get to a point of having closer to 2,400 tests a day to really monitor, especially if we want to come out of a shelter-in-place order. Right now, there are 3 locations where testing is happening in West Contra Costa. If you are a Kaiser patient, you can get tested at Kaiser Richmond. If you are a member of the Contra Costa Health Plan, you could get tested at the county's health clinic in San Pablo. And if you get your care through Lifelong Medical Center, you can get tested there. That testing, those 3 test sites have been up and running since early to mid-March. Last week, the county expanded its testing at its health clinic in San Pablo for anybody who wants to get tested there. And that's free drive-through testing, and that is available now for anybody, not just Contra Costa Health Plan Medi-Cal patients. The county's been at the center of responding and preparing with regard to this virus. We estimate that between March and June, we will have spent $100 million out of our reserves to address the health and economic consequences from the virus. We've been working with all hospitals in the county to double their hospital capacity to prepare for a potential surge in patients, which fortunately we're not seeing yet. There's about 1,100 hospital beds in this county, and that capacity is being increased to about 2,200. In addition, working with federal and state partners, the county has opened a medical center at the Ford building at the Craneway Pavilion in Richmond that would have 250 beds. We have not needed to open that, and we hope we never will, because we hope our hospitals will not get overcrowded. Those beds will only open if hospitals are overcrowded. We've also prioritized our homeless population. We have rented close to 500 hotel rooms in the county, and that will soon go to 600, and have transferred homeless individuals from shelters, the 3 largest shelters, including the Richmond Rescue Mission and the county shelter in North Richmond and one in Concord. We've transferred about 250 of those individuals to these secure individual hotel rooms where they are receiving care 24/7 by one of our community partners. And we've also identified vulnerable homeless residents at encampments and moved them to these hotel rooms. One of the hotels is local to the Hilltop area, and that's the Courtyard Marriott, which has about 145 rooms occupied that we've rented for homeless individuals. Most of those individuals were previously at the Richmond Rescue Mission. We've also taken steps to financially address concerns. Using our state emergency powers, we passed a countywide rent freeze, as well as pretty far-reaching eviction protections, and the City of Richmond has passed an ordinance as well. And the ordinance provides for no late fees, for no increases in rent, a grace period of several months, 6 months in the case of Richmond, for people to pay their rent. In addition, we have provided about $20 million in funding to our community-based nonprofit partners who provide health and social services to more impacted and vulnerable populations in our county, including many here in Richmond. We have set up a hotline for small businesses to call to help access federal and state revenue. So when are we going to come out of this shelter-in-place order? The Bay Area health officers just yesterday released a number of guidelines or indicators that we could measure. One is very similar to the governor's. One of them is having a decrease in hospitalizations for 14 straight days. Another is having less than 50% of our staffed hospital rooms in the county occupied by COVID-19 patients. Another is increasing our testing capacity to 2,500 tests per day. And also having the ability to do contact tracing and quarantine those who are tested positive. In addition, there will be, we set up an ability for free child care for emergency first responders and essential workers. So I'm optimistic that with the collective action we've all taken, that we will move through this, but there will be continual restrictions in place. There is concern of what will happen in the fall when there could be a potential second surge. So for now, our collective actions are making a difference. So I just want to thank Richmond residents for that, and end with a closing comment, which really was one that our governor said recently. He said, you know, you can't run a 90-yard dash when the race is 100 yards. And that's why our health officers believed it was important to extend the order and not lose the progress we've had and turn back yet. And they're going to be monitoring over the next few weeks all the data to look at where we go at the end of May. So with that, I just want to also say there's been a great partnership between the county and the city, with all of our cities, and there's been a great partnership here in the city of Richmond, who are important partners as we go through this.
Thank you very much for that opening statement and a broad view of what's going on, Supervisor Gioia. Now let's hear from Richmond City Council Member Nat Bates.
Thank you, Bob, and thank you, Hilltop Neighborhood Council and Fairmede, and Arthur and your leadership as president. Also, like to express appreciation to Pastor Jim and his beautiful staff for allowing us to use this outstanding facility. He's always available to lend assistance for community needs. I'll be briefer than the supervisor because we all recognize this is a national problem, a state problem, and a county as well as a city. But in Richmond, the county Board of Supervisors and Health are sort of the lead agency that is dealing with this problem. All of the funding, to a large extent, is directed to the state and the county. So for Richmond, we continue to run very much a full-time staff, especially our public safety, police and fire, public works, code enforcement, and various other agencies. Our meeting this past Tuesday indicated that we have probably less than 15 or 20% of our staff that are home and not being employed. So we don't have the resources to do a lot of things, and we have to rely upon the county for their direction. We don't have a health service officer in the city of Richmond, so therefore the county. So I'm going to conclude by expressing our appreciation to the many citizens in Richmond, in particular, who have responded positively to the mandate of spacing, wearing masks, and so forth. And that's the only way we can eradicate and control this virus, if all of us collectively pull together and respect the demands of maintaining the space and so forth. So I'm going to yield to, we have eloquent staff here, our police chief, Nisa, and Fire Chief Adrian, and Sasha, our acting city manager. They are the pros within the city that will let you know to a large extent what Richmond need to do and what we expect our citizenry to follow. So thank you very much, Bob and Supervisor John Gioia, for participating in this forum. And I think we collectively we will defeat this crisis, and hopefully very soon. Thank you very much.
Thank you very much, Councilmember Bates. And for those of you just joining us, we have County Supervisor John Gioia, City Councilman Matt Bates, Deputy City Manager Shasa Curl, Richmond Police Chief Nisa French, and Richmond Fire Chief Adrian Sheppard joining us here at Hilltop Community Church, thanks to the Fairmede Hilltop Neighborhood Council. Our leaders are here, they're practicing social distancing, and they're trying to help us in terms of how we can eradicate COVID-19 and reduce spread in our communities. So now let's go to Deputy City Manager Shasa Curl.
Thank you. I would like to concur with Councilmember Bates and Supervisor Gioia. We greatly appreciate the leadership that Contra Costa County and the City Council have all provided during this most difficult time. I also want to thank our residents, our community-based organization, and our staff for really stepping up during this extremely difficult time and being available to provide direct services to Richmond residents. And I think that's why, thus far, all things considered, we're extremely pleased that we've had a relatively low incidence. The City of Richmond has created an online portal and phone number to centralize COVID-19 related information. The website is accessible at www.ci.richmond.ca.us, and the phone number is 510-620-6700. Residents are encouraged to visit Richmond's COVID-19 information webpage, social media pages, and phone line to get more information and updates on city services, the shelter in place, and community resources. Please keep in mind that during this time, information is changing quickly and is being updated 24 hours a day. The Richmond Cares Hotline, again, the phone number is 510-620-6700, is in place, and the purpose of this hotline is to respond to callers with updates to city services available during the shelter-in-place order and ensure that residents are aware of the City of Richmond COVID-19 information page. At that page, you'll be able to access information regarding resources for small businesses, testing sites, and a myriad of other information that would be helpful. It's also important that we acknowledge that at this juncture, because we are operating our Emergency Operations Center, as well as trying to continue to provide a high degree of service and extremely high quality service to Richmond residents and businesses, that there may be some slight delays in response times, but the City of Richmond and all staff are committed to being responsive to residents and businesses during this time. Thank you.
Thank you, Deputy City Manager Shasa Curl. I'm also, thank you, Chief French. I am hearing from getting some feedback from some of our viewers that it's a little difficult to understand with the mask on. We are practicing social distancing, so if we could remove the mask while we speak, that might be helpful to some viewers. So thanks again, Deputy City Manager Shasa Curl, and now, Police Chief Nisa French.
Good evening, everyone. First, I want to thank everyone for their understanding and patience through this difficult time. And I want to thank the community for their willingness to engage with us in a different way. We spent the last 10 to 15 years really building and engaging with our residents here in the city. And so this is a tough time for us to not be able to get together the way we normally do. So I just want to start by thanking everyone. I know there's a lot of questions, so I want to save time for that.
Thank you very much, Chief French. And now, Richmond Fire Chief, Adrian Sheppard.
Well, good evening, and thank you for having us here this evening. I think this is an important meeting. I think it's a great opportunity for us to get out and deliver our message and to also receive from you, the public, what your questions are so we can get those answered. I also want to state that this is a unified effort. It's federal, it's state, it's county, it's local, but none is more important than the individual. And we are really counting on the individual to help us stop the spread of COVID. 6 weeks ago, we had very little idea that this would actually be our reality. And I could not be more impressed with all of my co-workers, my peers, who have stepped forward and reflects to this new event and really come together as a unified force to establish an EOC, to go out and respond appropriately, and to make better outcomes for people in the community. So with that, I will close my open remarks and take any questions that anyone has of me.
Thank you again, Chief Sheppard. And to remind those who are just joining us, we are having a community town hall with County Supervisor John Gioia, Richmond City Councilman Matt Bates, Deputy City Manager Shasa Curl, Richmond Police Chief Nisa French, and Richmond Fire Chief Adrian Sheppard. This forum is made possible by the Fairmede Hilltop Neighborhood Council in partnership with the Hilltop Community Church. These leaders are here practicing social distancing and providing the latest information as our communities work to fight against COVID-19. So now we will go into a period of questions, and we will start with Supervisor Gioia. Supervisor Gioia, can you tell us, the audience at home and the public, how the county works with the City of Richmond and the state funds to support homeless issues in Richmond? As we know, the homeless population is particularly vulnerable, and our public health is all inextricably linked across the socioeconomic spectrum. Supervisor Gioia.
Thanks, Robert. As I said earlier, we've prioritized helping and protecting our homeless population. And we worked with the city and with the Richmond Rescue Mission and our own health department to identify those who are most vulnerable to move them into hotel rooms. As I said earlier, the rescue mission itself, those residents have all been transferred to hotel rooms as well as the shelter in North Richmond. We recently, at the request of the city, delivered portable toilets and hand washing stations to a number of sites throughout the city where homeless people live or congregate. And the purpose of that is to keep those places sanitary to reduce health concerns. We're participating in Governor Newsom's Project Room Key, which is really the program where we've gotten some state funding to be able to rent hotel rooms, and working locally identified 2 hotels in Richmond, one at Hilltop and one lower on Cutting near Point Richmond, to house homeless individuals, and we've identified hotel rooms in other parts of the county as well. We have a close relationship with first responders and police and fire. You know, the way that health order works is, while it's initiated by our Contra Costa health officer, its enforcement, which is really more educational, occurs at a local level, including local police department. So, for example, if someone is not following the order, like if you see a church or a restaurant that's open and serving people, or people are congregating and they shouldn't be, you would call the local police department. And their role is not to go out and to find people, but they've taken a very friendly educational approach, knowing some people may not know all the provisions of the order, and so they go out and try to inform the owner of that establishment that they may not be conducting an activity that's allowed. So that's generally how it's worked. It's that type of relationship. And I think it's important for all of us to continue, frankly, for both the city and the county, to advocate at the federal level for more funding, because local government alone can't handle this. We are all going to see a decrease in revenues, and we already are beginning to see that. And it is really important that the federal government continue to fund cities and counties in responding to this crisis.
Thanks so much, Supervisor Gioia. Now, Councilman Bates, and if you would feel comfortable, sir, taking off your mask for this answer, I think it helps with the audio. Councilman Bates, can you talk a little bit about communication among city departments with residents during this pandemic? What lessons can we draw from the way the city and its residents have worked together? Where can we improve, and where should we celebrate?
Well, that's a very difficult question to respond to, and I think it's better referred to our Assistant City Manager, who, as policymakers, we work with the staff to assure that we proceed in a direction that benefits all of our citizenry. In detail, the staff bring forward the recommendations, and we peruse it and evaluate it, and then we proceed. So I think that question would be best referred to our Assistant City Manager to talk in details about how we are responding in that direction.
Thank you, Councilman Bates, and we will take that. And we also do want to hear from the Deputy City Manager on that score and more. Shasa Curl, if you would feel comfortable removing your mask for the answer, it would help the audio for the audience at home. Piggybacking off of the question that Councilman Bates also addressed, what is the city doing well, and where can improvements be made? What kind of things have we learned from the responses that have been necessitated by COVID-19? What have we learned from this crisis, and where can we get better?
Thank you very much for that question. One of the things that I think has been really beneficial to the City of Richmond has been the City of Richmond City Council's leadership and partnership with Contra Costa Health Services and UC Berkeley in focusing on health and all policies. And so over the last 10 years, we've been in collaboration and in partnership working to reduce health disparities in Richmond. We have been fortunate to receive support from the California Endowment, the Robert Wood Johnson Foundation, and others, and working to address these health disparities, because that's something that's been highlighted now more so than ever, and something that we've been working in Richmond on for the last 10 years. And we understand that health disparities and the resulting health inequities are the consequences of a variety of different social factors. They include income inequalities, economic forces, things such as environmental conditions. Also, I think really important to acknowledge is historic institutionalized racism, as well as access to health care and health behavioral choices. So this frame around health disparities, we understand that they're not fair, they're not inevitable, and it's a driving force behind our health and all policies work, where we've partnered with a host of different community-based organizations to improve the built environment, to improve access to health care, and we really appreciate the ongoing partnership, again, with UC Berkeley, Professor Jason Corburn, staff at Contra Costa Health Services, And it has enabled us, again, with this leadership of the City Council, to think of before COVID-19 even happened, that we had a health element in our general plan. And so we've really been using a frame across the entire city organization for in excess of 10 years that city staff are community clinicians, and we've focused and organized our efforts in the city of Richmond around improving health outcomes. And I think because of this, it's become a national best practice that we're fortunate that we have built the trust that the police chief was speaking about with residents and community-based organizations. And none of us could have imagined that we would be here today. But because of this work that we've all done over the years, we are better positioned to respond during this pandemic. Thank you.
Thank you very much for that thorough answer, Deputy City Manager Shasa Curl. Let's move over now to Police Chief Nisa French. Chief French, we know that COVID-19 has been an unprecedented pandemic, at least in our times, and it's surely challenged the police department in ways that you could not have imagined. Can you talk a little bit about the kind of challenges your officers are facing out there and what you and your team are able to do to support the public and the public health in the city of Richmond?
Sure. So the health and safety of my officers and the community have been my number one priority. And this is especially difficult during this time because a lot of the camaraderie and just the building their relationships include getting together. So we're learning to do things in a different way, and that means not having a lot of officers and a lot of people come into our building, and so that means learning to do our lineups and get together in an outside environment where we can practice social distancing, not getting close to each other at as many calls as possible, and really separating our workforce so that they're not coming into contact with each other. And that's really difficult because that's how we, talk to each other and learn about what's going on. So we're having to rely a lot on technology, which is a blessing and then also a curse, because nothing replaces that face-to-face contact that we're used to. So we're just learning to do things in a different way, learning to interact with our community in a different way. We've done some Zoom town hall meetings and other community engagement type things so that we could continue to engage in ways that we're used to doing. And so just trying to learn how to do things in a different way.
Chief French, thank you so much. Thank you very much, Chief French. Let's move over to Chief Sheppard of the Fire Department. Some of the audience wants to know about the firefighters and the work they're doing in the community. Number one, the same question really that Chief French addressed, which is how is this challenging your department? How are you able to respond to the needs of the public during this time? And also, have any firefighters been tested positive themselves? Are there any other ways in which COVID-19 has affected your staff or your team? Chief Sheppard.
Absolutely, thanks for the question. So, just the nature of firefighters, we're very aggressive on doing our jobs, and we like to get in, we like to help people. And helping people on EMS calls means going in as a crew and putting our hands on people, making sure that we're getting them the best medical care possible. And we've had to figure out new ways of doing that job. We've had to enhance our medical care and making more certain that we're providing the same level of service to our citizens. This has become more difficult as we don our own PPE that we hadn't previously donned. Face masks, wearing gowns, making sure we have face shields on. These aren't things that we've previously done on a regular basis, but we've adjusted to that. Second part is making more certain that we keep our workforce safe. And I have a fantastic crew, my command staff, my battalion chiefs, my project manager. These are all people out there, my infectious control officers, who are really staying in tune with the county health officer, making sure that we get the latest and greatest information on COVID, and really getting that information out to our people on how they can remain safe and respond appropriately to these medical calls. None of our firefighters have tested positive, though we've put people under medical surveillance over the past couple of weeks. I'm happy to say that they've come back negative. So that tells us that we're doing the right thing right now, because we are coming in contact with people who case positive for COVID-19. And so another part of the answer to your question is, this is just a new reality for us, and though we're steeped in tradition as a profession, we certainly are not beyond making adjustments. And so we've adjusted to this. We're going to make more than certain that we're getting out to maybe some of our congregate living facilities, making sure that the people there are staying safe, and additionally some of our care facilities. We want to make more than certain. I think it was mentioned earlier where one of the larger breakouts of COVID-19 was in Orinda, and we certainly don't want that to happen anywhere, but certainly not anywhere where we have jurisdiction. And so we've been very, very attentive to these facilities, making sure that we get out there and that we're making sure they're safe. So that's how we're doing our job.
Thank you so much, Chief Sheppard.
Robert, a suggestion based on the comments I'm reading on at least our Facebook page. I think, is it the mic from the phone that is going through this one of the Facebook pages and the other mic to the other, and it may be when you just have to get close with the mic on that iPhone.
Excellent advice, Supervisor Gioia. Let's do that, and let's all be mindful of raising our volume a little bit. We have some audio challenges we can overcome with a loud, strong voice. Supervisor Gioia, let's talk a little bit more about that 90 yards of a 100-yard dash concept. The governor has talked about how it's important to not let up. On the other hand, we have good numbers in Contra Costa County. We have reduced the spread. We've done a great job. Can you talk a little bit about what the public can expect with regard to what we might be looking at time-wise, and most importantly, why we have to remain vigilant, even if some of the infection rate numbers are lower here as compared to other counties? We know that progress is fragile. Can you talk a little bit more about that?
Sure. The Bay Area health officers and the state have been working very closely together to look at data and look at the experience of other communities, including other countries around the world. And what they see is that it's important to not only get over the peak, but to reduce the number of new cases over time before, in a more substantial way before easing off and allowing more people to go back out to work. So what our health officer has said, the current order goes through the end of May, and after that, they will be looking at the number of hospitalizations in the county that are COVID related. They're going to look at the ability to conduct 2,400 tests a day in the county. They're going to look at other hospital capacity issues, the ability to do contact tracing, and will incrementally come out of this health order. What does that mean? It means to open up more essential businesses. Just like in the new health order, all construction is now allowed as long as safety precaution and distancing precautions are taken. So there have been an increase in what's allowed. That will happen over time as we go into June or July if the numbers continue to improve. However, don't expect to see a return to normal right away. In fact, we're going to continue to see restrictions on mass gatherings. We'll continue to see the need for more vulnerable and older individuals to stay home. So the good news is that they're monitoring the data and believe that if we were to open up substantially at this point, we would see a surge in cases again and a surge in hospitalizations because we haven't yet defeated really the transmission. While we've done a good job, and that good job has saved lives and it's resulted in less people being hospitalized, it hasn't ended the total transmission. So we're really in this for a long period of time. The other concern is what will happen as we hit the flu season in the fall. If you look at the history of other pandemics, including the 1918-1919 flu, there was a more minor or smaller outbreak in March, and then more deaths and illness occurred during the surge during the fall and the winter. So we don't know enough about this virus. So health officers are being cautious, but they also understand that we want to all get ourselves back to work as quickly as possible. And that will happen quicker the sooner we can be down that curve. We're flattening the curve, but we have to be down the curve more. As I say, one indicator is 14 days every day of decreasing hospitalizations. And so we're getting there. We all deserve, the community deserves credit for that, but there needs to be more work.
Supervisor Gioia, thank you so much for that thorough answer. Let's go ahead and address a question that just came in on Facebook. It's a good one, and it's for our public safety professionals, Chief Sheppard and Chief French. Let's start with Police Chief Nisa French, and this question comes in from Edie Sellers. Thank you, Edie. And the question is, what are the calls for crime and safety load right now compared to quote-unquote normal times? Are we seeing fewer calls for crime and incidents since COVID? Or are we seeing different types of crimes and calls? It seems like in some communities there might be more robberies and car thefts than others since COVID began. So, can you address the question of what's happened with calls for service since COVID?
So initially, in the first couple of weeks, calls for service had initially gone down. Unfortunately, over the last few weeks, we've seen an increase in crimes and an increase of activity, especially shootings and domestic violence calls, which we are very concerned about. We've been trying to use our social media platform to talk about domestic violence and violence in the homes to make sure that people know that there are resources available. Our family justice centers remain open and available to serve our community during this time. So I encourage anybody that needs the services of the Family Justice Center to contact them. Initially, we had reduced the amount of proactivity our officers were doing because we were concerned about their exposure to the community. And so we weren't doing a lot of proactivity in the streets. However, we've seen that with the increase of accidents that we're seeing, and just the increase of activity that we see in our community, that we had to step up our level of enforcement. And so we are doing that at this time and making some arrests that are very valid and needed during this time.
Thank you, Chief French, and thank you again, Edie Sellers, for the great question. And let's have Chief Sheppard address that question as well. Again, this question from Edie Sellers revolves around what kind of impact COVID-19 has had on public safety calls and what impact, if any, on the type of calls that you're getting, volume and type. Chief Sheppard.
Absolutely. Well, first, good evening, Edie. She's a fantastic community member, fantastic volunteer, and she certainly helps out our emergency managers, so thank you. For our calls for service, the numbers initially dipped, but we see them going back up, but they're not going back up necessarily because of COVID. I think people were cautious when the pandemic started, and so they were not utilizing the EMS system as much. However, the cautionary tale in that is that even though there was a dip in the number of calls, or the volume of calls, it was a greater time on scene doing medical because our members wanted to make more certain that they were diligent in making sure they made a full assessment of every patient that they came in contact with. So while there may be less numbers of calls, I think there's been a greater workload on our members as a result of COVID-19.
Thank you so much, Chief Sheppard. As we all know, not only are there major public health implications about COVID-19, but down the road there will be costs in many other ways as well. COVID-19 has financial implications for levels of government at all levels, including the county. Supervisor Gioia, can we talk a little bit about the kind of challenges that the county is seeing in terms of both expenditures and revenues, and how this might impact the public moving forward?
Well, we know that so many families are facing financial hardship. And I think, unfortunately, we're going to keep seeing more of this as unemployment claims rise and the number of individuals coming into our social services department seeking social service benefits. So our Department of Employment and Human Services has been handling an increased caseload for food stamps and other benefits. So we've ramped up there. We also have gotten calls into our small business helpline, trying to link these businesses to federal and state funding. We are in for really difficult times in government as well. We expect our revenues to drop, both our sales tax revenues, our property tax revenues. So, and the city, I'm sure, is facing the same challenges. So we would ask that those less, at this point, folks contact departments for those lower priority work and allow us to handle the high priority work of health and social services. We are linking to efforts at the state level, and our legislators, both Senator Nancy Scalia, Member Buffy Wicks, have been great advocates for local government at the state level. And that is why we're continuing to lobby Congress for more funding to cover our expenditures. I said we are going to spend $100 million by the end of June. That's $25 million a month. We are hoping we get reimbursed for most of that. We don't know if that's going to happen. And if you add that on top of lost revenue, think of the challenges. We are already seeing concerns about lessening library hours because of the challenge on our budgets. But I think the biggest hardship is going to be on families. And so while we can help continuing with social services, that we don't have the ability to replace people's lost revenue. So while we can stop evictions and have rent freezes, we don't have, people will be facing challenges to repay that rent, whether it's 4 or 6 months down the road, which is why a strong, vibrant federal response needs to be there. Otherwise, families are going to take longer to get back up on our feet. So I wish I could say this would be easy. It's not. And we're all in this together at the local level, and that's why we're standing together to really advocate at the federal level. And one example of a family that contacted the county was their comment that they didn't qualify for unemployment because they did not have, they were a contract employee. These are the kind of things that would need to get fixed. And while the state has expanded that, we need to go further. There are so many people in this economy who didn't have traditional jobs, who aren't eligible for unemployment, and are not able to support their family, and they're coming into us at the county to get more food stamps or other benefits. So things need to be fixed also at a state and federal level.
Thank you very much, John. And we're going to do a follow-up question here. And I also want to give a tip to Councilman Bates and Deputy City Attorney Curl that we want to talk about finances in the city as well. Before I do that, we did just get a question in from a Miss Gilbert about antibody testing in the county and in the city. Is antibody testing something that's coming soon? And is there a socioeconomic aspect to testing? Are the poor able to get tested? Are we concerned about inequities there? Supervisor Gioia.
We have a lot of discussion with our health officer about testing. So let me first talk about antibody testing. There is no current FDA-approved antibody testing methodology yet. There are some companies out there who are beginning to do it, but our health officer does not recommend going and getting antibody testing. There are some studies that UC San Francisco is conducting in particular communities. I think we are going to have to wait to see the results of those. It doesn't do any good to do a test that is not accurate and is not meaningful. It can give you a false sense of hope or harm. So I think whether we're a few weeks or a few months off for antibody testing, we really don't know. It's probably more likely months off. That is a really important test because it tells you if you've had the virus, not just if you have it at a given time. So we're still a ways off. to getting meaningful antibody testing. As to testing in general, it's no secret that in this country, there was failed policy at the national level that resulted in a slow response to getting more testing. And we are still recovering from that, but we're recovering as quickly as we can. And so while there's about 300 to 400 tests being conducted per day in Contra Costa County, our health officer believes we're going to need to get to 2,400 tests a day to be meaningful, to slow the spread when we come out of a shelter-in-place order. Right now, testing has been limited to people who have symptoms, and that's because there's a limit in the testing capacity. Once we can get beyond the limit of testing capacity, then the protocols for testing could expand, and we could look at not just us at the county, but Kaiser, other providers, to testing more people who have symptoms. I hear so many times from people saying, I just want to get tested. The reality is we can't test everybody until there's enough, or more people until there's enough testing capacity. So as to who can get tested, as I say, the county is offering free tests to those with symptoms at a location in San Pablo, and if you can call our county number. If you go to my website, John Gioia's website, we link to our county health department, as well as all the information on the virus, as well as being able to link to the health department to make it an appointment. But let me stress this. What our health officer says, you should always ask your primary doctor and provider first. Most people have health insurance, not everyone does. So it's to talk to your doctor, and that's how you first get testing. And then we want to try to reserve our testing for people who don't have insurance, for people who don't have access to health care. And that's why we've opened up this drive-through testing for anybody.
Supervisor Gioia, thank you so much for that response. Reminding those who have just joined us, we are here at Hilltop Community Church, thanks to the Fairmede Hilltop Neighborhood Council. We're having a town hall forum, practicing social distancing, using our masks when we can, and helping basically work with everyone to reduce the spread of COVID-19. And now for you, Councilman Bates, let's talk a little bit about the financial impact that you see. We know all the numbers aren't in, we know the toll is not accounted for completely, but we are probably looking at a major challenge at every level of government due to the costs imposed by COVID-19 and its response. What are you thinking about? What's worrying you? And what ways forward are you seeing for your city as COVID-19? Hopefully we win that battle and then go on to the next.
Well, as Supervisor John Gioia indicated, revenue is a source of operation for all municipalities. Richmond is no different than any other city. Our primary revenue comes from property tax, sales tax, utility tax, building permits. Obviously, with the businesses many not being able to operate, and those on limited operation, the sales tax has taken a big hit. Some estimate as much as 50%. In Richmond, I think our last review was about $42 million annually in sales tax, which means that we're estimating about 50% reduction or thereabouts. That's going to take us down to a $20 million deficit. And there's no way that you can make up that within the next 6 months. And we're pleased that the League of California Cities, the National League of Cities, are working with Speaker Pelosi and other Congress members to provide some federal aid to local jurisdictions. What we've seen is federal aid is going to almost every identity, the businesses, small and big, as well as others to the county and some to the state. But there has not been any legislation that is directing revenue lost to the cities. And that's something that desperately will be needed by Pelosi and the Congress to act positively upon. So until we get that kind of relief, we're looking at a deficit budget, and anyone that understands local government mandates that, unlike the federal government, we can't just print money and just keep going. We must have a balanced budget by July the 31st. And how we do that is going to be a difficult and a challenging time. And the only way, if we don't have the finances, we usually have to look at the reduction of staff. And that's unacceptable for our citizenry. And those are the situations and the positions that we're in right now. And we just have to fight it out and wait and see what Congress does with regards to providing some financial relief.
Thank you, Councilman Bates. We'll also be going to Deputy City Manager Shasa Curl with that question. I did see you over here, Supervisor Gioia, really wanting to chime in as well. Can you help us understand a little bit more about this?
Oh, I was actually really going to make a comment that people are still saying they're having trouble hearing from us. I just wanted to acknowledge how to get the mic closer so everybody could be heard. And I was going to respond later after this to one of the questions that came up about masks and people being asymptomatic. So I'll wait until after this question.
Wonderful. Let's revisit that. Deputy City Manager Curl, we heard from Councilman Bates talking about major deficits possibly coming down the pike. When those happen, there's concern about staffing, there's concerns about service levels. You're seeing all the numbers. I know it's at an early juncture, but what are we looking at, and what kind of strategies do we have to brace for in order to meet the future?
That's a really good question, and I concur with Councilmember Bates. The Mayor and Richmond City Council have provided great leadership to staff. We are working every day to put forward and develop solutions around revenue enhancements and increasing cost recovery, and more importantly, thinking about how do we deliver services in light of COVID-19, and how do we begin to think about and implement as quickly as possible revising and revisiting our service delivery models. And so this is really called for local government to really adapt. We're fortunate that we're here in the Bay Area. We have great staff, so we've been conducting city council meetings on Zoom, and we're really trying to do the best that we can to continue to ensure that development projects move forward through the pipeline. Those projects are important. We encourage Richmond residents to continue to shop here locally, order food. Our Chamber of Commerce has a great list of businesses that are currently open. And for all of you, like myself, that shop here at our local Costco, we know the lines are long, but we're counting on you to continue to safely social distance, order online, pick up, but continuing to patronize our local Target, our local Costco will help us with our revenue. But ultimately, this is a difficult time, and we do need some assistance from the federal government. For this current budget cycle that we're in right now, which is fiscal year 1920, we are at this juncture, and again, this is moving every day, we're at approximately a $7 million deficit. And so that means that we will be coming to the City Council with some options for their consideration in terms of how to address this. We have an ad hoc committee that the mayor has appointed, so we're meeting with the mayor and Councilmember Choi and Councilmember Willis, as well as our labor unions from all labor unions are participating, and various staff, and really trying to come together collectively to solve this problem. We know that it's very difficult, but we know that everyone can contribute to helping us bridge this gap that we're facing here in the short term. And moving into next fiscal year, it's going to be even more challenging. And so we do need to brace that things are going to be different. And it's an opportunity for us to also try to do better. We know that the city has always, we're in Contra Costa County, you know, we're a full service city, we have a port, we have really great police and fire, we have libraries, and we really pride ourselves on being a full service city. And so during this time of COVID-19, again, we're going to be relying heavily on our IT department to help us transition our service delivery models and work continuously in collaboration with our community-based organizations, because they're already doing that pivoting. They're already continuing to provide service. I know the organizations like the East Bay Center for Performing Arts, RISE, NIAD, a host of nonprofits in Richmond, the Ed Fund, they are still, the Richmond Promise, for example, still providing great service. They have Zoom calls, and they're making sure that young people in our community, seniors in our community, are getting direct service, and it's primarily through the utilization of their phone. And we expect that we're going to continue to improve service delivery, and we're going to have to figure out how to do that with less resources, and that's our challenge. Thank you.
Thank you very much, Deputy City Manager Curl. And we heard you talk about supporting local business, and I think that we all see that. We know that COVID-19 is a tremendous stress on our local businesses, and folks, if you want them to be there and be able to provide the kind of services that you liked before, try to figure out a way to support them now, because they need it. I know there's a lot of small businesses downtown, other parts of the city that are really hurting during this crisis, and we all need to come together. Thank you, Deputy City Manager Curl.
Thank you.
And this one is for our public safety professionals. We have some questions, some real bread and butter questions from folks in the audience. And they are asking about the rules. And this one says, many of us stand in those lengthy lines at Costco, the Costco lines that Shasa Curl referred to, Home Depot and others. And we see many people failing to observe social distancing, not wearing gloves, and so forth. With the new county health orders, what are the Richmond Police Department's policies with regards to enforcement? And what really is allowed? Are people allowed to play basketball at the park, or church gatherings, or biking and jogging? Can you tell people a little bit about that for the city of Richmond? We'll also talk about that countywide with Supervisor Gioia, but a little clarity for folks about how to go about their daily business. Thank you.
So thank you for that question. Like Supervisor Gioia said earlier, really our main goal is to educate people about the order. So we get lots and lots of calls about people not social distancing, people not wearing masks. We get so many calls that I just can't have, I don't have enough officers to respond to the amount of calls that we do receive. I do have my regulatory unit who is responding to businesses and calls that we receive when they're able to, and they're also educating. We only want to move to enforcement if there's really willful defiance and if it's, you know, continuing over time. So I'll go over some of the things that are allowed. So we get calls about people playing basketball in the park. Is that allowed? These activities really should be limited to the same household. People should not be getting together. It should not be a pickup game of basketball at the park. If you live in the same household, then you can congregate together. If you don't live in the same household, you need to social distance yourself. We received questions about faith-based groups, church gatherings, and I know this was a big thing. We had Easter during this period, but really churches should not be gathering together at one location. They should be using streaming services or any other kind of services that they could use during this time. And I know that's difficult during this time, especially when people want to worship and get together and pray for each other. But there's a way to do that through social distancing. We get questions about, can you take a walk around the block? Can you walk your dog? Absolutely. We're not trying to limit people to be in their house. We don't want people to interact with each other, but you can take a walk. You can walk your dog. The dog parks are closed, so you can't do that. But we're not going to criminalize people for getting out and getting a mental health break from being in their house all day long. We've received questions about people traveling outside the city. I know that there's other cities that their orders limit where you can travel to. This county It does not limit where you can travel to, so we won't be looking to cite people that travel outside of 5 miles from your home, for instance. Large family events and gatherings, can't do it unless, as I said before, you live in the same household. Parties at residences, we respond to a number of party complaints day after day, especially on the weekends. And while we try to respond to as many calls as possible, we're asking people to police yourself. Continue to social distance and don't engage in activity outside of your house with people outside of your household. Construction projects, the last county health order allowed that to resume, so people will be able to do construction. Barbershops and beauty shops will remain closed, so that's not permitted. Gardening, I think the recent ordinance, the recent health order allows for outside activity like gardening services. And we received questions about vendors. And as long as the vendors are practicing social distancing as provided in the health order, then that's allowed.
That was fantastic. Thank you, Chief French. You heard a really comprehensive list of kind of the do's and don'ts in Richmond during the COVID-19 Stop the Spread effort. So if anyone needs a refresher, go back on this video to that presentation, and that covers just about everything. Chief Sheppard, I know that you're not called upon to enforce those kinds of things much, but if you have any more that you'd like to share with regard to safety and health and cleanliness with COVID-19 and the kinds of things that you and your staff are seeing, please share.
But just like the chief indicated, you know, it's incumbent upon the individual to make sure they're practicing or having good, safe practices. That includes when you're walking down the street, yeah, we want you to get out, we want you exercising, we want you getting fresh air. If you're walking down the street, crossing the street or something like that, use crosswalks, use them one way. So people cross one direction in one crosswalk, and on the other crosswalk, you go the other direction if you're at a four-way. Simple things like that, good hygiene around the house, good hygiene when you're out in public. Put a glove on if you're touching surfaces that you're not familiar with, i.e. gas pumps or something like that. Wear your mask. I think the question came up earlier about people who aren't practicing social distancing. You're going to encounter that, we know that. The thing is, if they're not, you're protected when you do have your mask on, and they're not doing it. So, you know, we certainly want to build redundancy into it where everyone's doing it, but if not, just make sure that you're maintaining your own personal safety.
Thanks so much, Chief Sheppard. And while we are on the subject of, great questions coming in from the audience, we have one for the City Manager again. This is Deputy City Manager Shasa Curl. And this one is another kind of bread and butter issue. The question is, many people believe that with our roads nearly empty these days, it'd be a great time to fill some potholes. I'm sure you get this question a lot. Or maybe work in libraries or different departments can proceed or can be processed and updated. Would this, I think they're talking about the street work, be permitted work? And if so, is this something that we've directed to be done? And if it's not allowed, or if it has not been prioritized, why not? So, in any event, while the streets and infrastructure are being used less, is this a good time to do more work to them? Deputy City Manager Shasa Curl, please.
Thank you very much. Those are, again, great questions. We have an amazing public works department, and during this time when we are following the county health order and we have operated our emergency operations center, we are focusing first and foremost on providing essential services. And so our very experienced public works director, Yara Bermudez, is leading the public works team. And so things that are planned that are considered essential services, for example, our blight abatement is a health and safety issue. And so those are the kinds of things that the Public Works Director is ensuring that we continue to address, and he is working collaboratively with all the Public Works staff to make sure that those essential services are still taking place in Richmond. Obviously, the longer this proceeds to take place, that is going to evolve. And so initially, people probably perceive that there was potentially less, you see less people around, but as things have proceeded to extend out, we really commend that he's done a great job of working with his team and being, the staff are being nimble, and anything that they can address that is perceived to be and is in fact an essential service, they have been very responsive, and specifically around the issue of abatement. And so that's, abatement is a huge health and safety issue, and something unfortunately that we struggle here with in terms of illegal dumping in Richmond. And so the crews have been out every day. I see them in their trucks, Hugo and everyone on the team there picking things up, and we really commend their efforts, and we're working collaboratively with Republic Services to continue to provide good, high-quality service to Richmond residents during this time of COVID-19.
Thank you, Deputy City Manager Shasa Curl.
Thank you.
So we have more questions coming in on homelessness, and we want to address those. This one's from Rodney Alamo Brown. Hi, Rodney. And I also want to invite all the new viewers to know that we are here at Hilltop Community Church, thanks to the Fairmede Hilltop Neighborhood Council, having a town hall forum with some of our county and city leaders to help us understand how we can better stop the spread of COVID-19. So Supervisor Gioia, the question is, from Alamo Brown, what are we doing? I know we've gone over this in some detail, but if we can revisit this, what are we doing for the homeless in Richmond? And how will we, the efforts that we're doing now, how will they change when the COVID-19 crisis has passed?
So, as I said earlier, we have moved all of those who are living at the Richmond Rescue Mission and the county shelter in North Richmond to hotels around the county. Many of them are at the Courtyard Marriott. And we are working with GRIP, Greater Richmond Interfaith Program, and others who are also staffing and helping provide services to those individuals who are housed at these hotels. They are eating 3 meals a day, they're getting health care, and then our homeless outreach teams are directly going to encampments where we provided portable toilets and washing stations, and identifying and testing those who would need to be tested. Fortunately, there's been no outbreaks in encampments or at shelters. And those homeless who are vulnerable, medically vulnerable or otherwise, are also taken to hotel rooms. I was just out yesterday along Wright Road near Point Isabel Regional Park, and saw, as the public knows, there's many individuals living in their vehicles or living in RVs, and while the toilet and the hand washing stations are there and are helpful, those individuals face many challenges. So we are having homeless outreach teams in contact, finding out their needs. I think when this is done, we will face a major question and decision. Our homeless services directors talked about this. We don't necessarily want to take those individuals who are in hotel rooms and put them all back in shelters. So I think we are going to need to work with the state and identify the funding and the resources that are needed to look at how we address homelessness in a different way. The governor has a task force that he's established of folks from local government to make recommendations. But I think this crisis which has caused us to take so many homeless individuals out of shelters, and some from encampments out and put them into hotels, raised the question over what we do next. And I think it will be a good opportunity, frankly, with resources to go to a different model and do things differently than we have. Let me also say something about housing issues related, because some questions have come in on financial, on housing. What we also don't want to have individuals who are currently housed become homeless, which is why the county and the city have put into effect pretty far-reaching eviction protection ordinances, and in our case, a rent freeze, because we don't want more people to become homeless. So we will be faced with some tough questions on getting resources from the state, to handle things differently. I noticed there were some questions, Robert, that came in more about the what's allowed under the order, and I wanted to maybe address that now.
Let's do that. Thank you.
One of the areas that I think is really relevant now as we get into the summer about the expansion of what's allowed under the order is some types of small summer camps and recreation and educational activities can occur. So under the new health order, groups of 12 or less children who are the same children every day, so the same stable group, can participate in a summer camp, an educational program, a recreation program. So this is something for cities to think about through their park and rec, as long as it's the same 12 kids every day, they don't mix with other groups, and it's the same instructor or staff person working with those kids. So that's something that will be allowed under the health order this summer. I hear also so much from individuals about, what do they do when they're out running or biking and walking. What our health officer has said is that people who are running or biking should be conscious that the virus can extend, we talk about 6 feet of social distancing, can extend more than 6 feet from somebody who's biking or running. So be conscious of people around you. Be conscious of people in front of you or behind you. And that is why, I want to stress, it is important to wear a mask. Wearing a mask protects other people from getting the virus from you, and you're protected when other people wear a mask. The fact is that a large number of people who have this virus don't have symptoms, don't know they have it, and can still transmit it to others, which is exactly why I think if we're going to come out of the shelter-at-home order soon, masking is going to be, face covering is going to be a very important part of that. People are going to that's going to become a way of life for some time.
Thank you, Supervisor Gioia.
One other financial point I should just mention. If you have not paid your property taxes, the treasurer has set up a program where you can pay your property taxes late. Right now it's till June 30th without any penalty or late fees by just filing the form showing your financial hardship. And depending how long this goes on, that could get extended past June 30th.
Thank you, Supervisor Gioia. And if I may follow up with a couple of quick lightning questions, because they're coming in really well. I want to thank Marissa Monaghan and John Sargent. Marissa Monaghan and John Sargent, thanks so much for your questions about homelessness. The questions are, and I think you may have touched on some of this before, but how many hotels are taking in homeless, and where is the funding coming from to provide that?
So the county is working under a state program, so it's generally money from the state. We hope that covers it all. We have already rented 450 hotel rooms. We will be increasing that to 600 hotel rooms, and we've transferred 250 out of the 3 largest shelters into those, and we have space for more that we may want to move out of an encampment, people who are medically vulnerable. So these are hotels all over the county. There's 2 in the Richmond area, and the purpose is, again, to move individuals from shelters to these stable environments where they're getting 3 meals a day and care.
Thank you, Supervisor Gioia. And Councilman Bates, another question about communications with the city. There's apparently some concern about finding out about resources within the city, rules within the city. Certainly workers oftentimes have to work remotely now, and there seems to be some difficulty from some residents in finding out about resources or interacting with city government via the websites, phones, and so forth. We'll ask Deputy City Manager about that also, but from your perspective, what's going on with communications with the city and its residents? Any resources you want to talk about or any challenges that we need to overcome? Councilman Bates.
Well, this is a long-standing problem from my perspective. Having been around a few years where we had a greater degree of communication, but with technology now, where it seems to be every time you call in to City Hall, especially your banking institution, you get these machines, asking you this, and directing you here, and so forth, and it's quite frustrating because we no longer have a person who answers the telephone and walk you through to the various departments that you are trying to reach. Some departments you refer to Public Works, to Code Enforcement. The line goes there, but there's no one there to respond. And that's a communication problem that not only the city of Richmond, but most businesses and other governmental agencies. I don't know how you resolve that, because anyone that try to conduct business, as I indicated, with anyone, banking, other institutions, this business of going to one and going to the other, even my doctor, I called him today, and my goodness, it took me about almost 5 minutes, well not 5, 3 minutes, just to get to the doctor, because they go through all of these different maneuvers. So it's a technological problem, and I don't know how you can resolve it. My recommendation would be to put a live person on these phones, but then you're talking about a cost. Everything is related to how much it costs. So I don't know how we resolve that problem without having someone that will answer the phone and direct you, and if there's not someone in that line, they'll redirect you to someone else. So that's a problem that government, businesses, and everyone else has experienced.
Thank you. And it also occurs to me that it is Vice Mayor Bates, not Councilman Bates. So thank you very much, Vice Mayor Bates. Deputy City Manager Curl, again, communications, so important during a crisis. Some residents are asking about resource pages at the city's website. Tell us about what the city's doing to get the information that the residents need.
Thank you. Again, I want to reiterate that the best number for residents to call, and I want to commend the council member, staff person, Trina Jackson. If you haven't met her, she's an absolute pleasure. She led an effort with our GEAR team, and there's a new number that's been established specifically during this time to assist, and that phone number is 510-620-6700. Again, 510-620-6700. In addition, for residents, we want you to know that we're here to be accessible. We always have staff in the city manager's office that are available to answer the phone, and that phone number is 510-620-6512. Again, 510-620-6512. If you are unable to get in contact with a specific department, we welcome your feedback. If you want to understand what activities are happening in the city, there's a COVID link. It's a bright red light on our homepage at www.ci.richmond.ca.us, and that takes you to all of our resources. And in addition, our city manager puts out a weekly report. You go to that same homepage and you hit the e-news button, and then every week you'll get a full list of everything that's happened across the city and in various departments in terms of what are the activities taking place. So you'll see the public works staff out in our community addressing the concerns that have been reported, many of which have been reported with the utilization of a cell phone. So we have a city app where you can report things if you see blight in your community, if there's a pothole, if there's a sidewalk that needs to be fixed. We want to know about it, and the best way to do that is e-track it. All of this information is on the city's website, and it also has a translation feature. So it's available in multiple different languages, and so we're definitely really here to serve. We understand that this can be frustrating, and that's why, for example, it's really important for people in our community to know that even though City Hall is closed for people to actually come inside, we are here to serve residents. The building department is open, code enforcement is open. All of our community development staff are working, they're processing applications, and we know that it's important now more than ever to be responsive to residents and to our business community because you're counting on us. So we're here to be partners. And again, we also really want to focus on the business development resources. We've got a lot of great partners in our community, like the Renaissance Center, the CoBiz space, Richmond Main Street, and so we're working with all of them now, and we'll continue to do so in the future to make sure that we're spreading the information. They all host really great classes, and all of this for local businesses is moving to online platforms like Zoom and Facebook, and we are encouraging our local businesses to take advantage of those services. Thank you.
Wonderful. There really is an amazing amount of resources on the city's website now. Thank you, Deputy City Manager. Chief Nisa French, we've got some questions about RPD and staffing. Staffing during COVID, hiring, I'm not sure whether you are hiring. Talk a little bit about the staffing levels of the department, whether hiring is occurring, and what you think the outlook might be during and after COVID-19.
So even before COVID started, we had staffing challenges at the police department. In our best days, back about 8 to 10 years ago, we had about over 200 officers, about 205 officers at our max. We're down to about 150 officers, and we have additionally 12 officers off on leave, so that brings us down even further. So staffing has been a major challenge. Back at the end of last year, I worked with the Police Officers Association and other staff within our department, and we did a department reorganization to make patrol a priority to make sure we had enough officers to respond to calls for service. That reorganization is still in place, and like I stated before, in terms of keeping our staffing separate, we're making sure that our investigation staff also stays supported, even though they have less people than they've had in previous years, because we brought more people to staff our patrol. So staffing has been an issue, continues to be an issue. We actually have 14 people in training right now. The difficulty is with COVID going on, it's difficult to continue their training, so that's being put on pause, even though they're still on the streets. We've just kind of paused the time that we'll have to extend the amount of time that they're in training to make sure that they receive the full amount of training that they need and deserve. We're continuing to hire right now. We had a testing last Saturday because we know that the hiring of police officers is very critical to our organization. We're going to continue to have people retire. Unfortunately, officers get injured or sick or off on long term, and we have to have people responding to calls for service. So we'll still continue with our hiring efforts, not just for police officers, for dispatchers, and a couple other positions that are critical to our organization. So while staffing is critical at critical levels, the service that we provide to the public remains our #1 priority. And that's why I said we're focusing on patrol. We have as many officers in patrol as possible. We're continuing with our training programs, even though they'll be extended. We're continuing putting officers in the academy so that we can continue to get them out on the street.
Thank you so much, Chief French. And same question to you, Chief Sheppard. Richmond Fire Department, staffing. What are the levels like, and what are you expecting in the future?
Absolutely. Just as the Chief indicated, we too have people in training right now. It's very difficult to keep our staffing where it needs to be for a multitude of reasons, but the one that first and foremost is that firefighting is very difficult and it's rough. It's a rough and tumble game. People get injured doing this job. So we've put people in training. We're going to graduate a class at the end of next month of 4 members. We want to continue doing our hiring because we think it's the best thing to keep our individual members safe as well as keeping the community safe. I think we incur more injuries if we work extended hours. So we are confronted with a multitude of challenges. Even running the academies right now, with the academy that we do have in place, it's very difficult for us to get the classes from some of the outside vendors. So just as the chief indicates, the training process will be much longer for our members. We do have injuries. We have maybe 7 or 8 people out right now with injuries, be it shoulders or knees and back type injuries, but these happen in this profession, and so we have to be prepared for that. But one thing I want to make more than certain is that the fire department, just as the police department, will always be there to respond. So you know, if you make the call, we'll arrive. We'll be there.
It's a comforting thought. Thank you very much, Chief Sheppard. And now I want to also, again, thank our great hosts, Hilltop Community Church and Fairmede Hilltop Neighborhood Council, for bringing together this really important town hall forum that we can have via Facebook Live on the Hilltop Community Facebook page, as well as Supervisor Gioia's Facebook page. And it's really important for us to be able to talk, have leaders together to answer questions, and work with the community. These are parts of the reasons why Contra Costa County and Richmond have done a stellar job at reducing the spread and keeping the numbers relatively low and saving lives. It's really been amazing. Contra Costa County and Richmond have done an incredible job, and what's really important now is that we remain vigilant until it is safer to return to a new level of normal. So with that, I think it's a good time for us to have some closing statements where folks can share anything they'd like. We'll start with County Supervisor Gioia, and again Vice Mayor Bates, Deputy City Manager Shasa Curl, Police Chief Nisa French, and Fire Chief Adrian Sheppard will all weigh in as well. County Supervisor Gioia, please, some closing statements.
Thanks, Robert. And again, thanks to our host, the church, and the neighborhood council. You know, we're all in this together, and we are going to get through this. I have just been amazed by the resilience of our community. I've been amazed at and really pleased to see the help that folks are offering others. For example, we have a link on our website to a mapping tool that shows where to get low-cost and free food. Please check that out. But there were so many individuals involved in helping set that up, and putting the sites in, and helping develop locations. We've gotten so many requests from people wanting to do things like fix masks. You know, take masks that have a broken elastic band and fix them, or where to donate money, or where to volunteer, where else to help. And I think the true community spirit is showing during this time. And I'm really proud of our communities in Richmond and in Contra Costa County, because when we get past this, I think this is going to build a stronger community for all of us. And I'll just close with this, and it's sort of the governor's analogy. This point here is a 100-yard dash, and we're at 80 or 90 yards, and we can't stop today. We have to continue our efforts through the end of the month. And the more we do that, the more we increase the possibility that we'll be able to open up more and get more people back to work. And I want folks to know that while our office is working remotely, we're all there, we're working every day, and if you have any questions linking to any type of service, even not county, please call us at 231-8686 or email us. And we will work to try to get you connected or get you an answer from whatever agency it involves. So thanks for stepping up and sticking together, and thank you for being such a resilient community.
Thank you for those helpful words, County Supervisor Gioia. I know that many leaders, including yourself, have helped to get the word out and work with residents to ensure that we reduce the spread of COVID-19 and we're able to save as many lives as possible. Vice Mayor Nat Bates.
Well, again, thanks to the Fairmede Neighborhood Council along with Hilltop and Pastor Jim and his organization for the utilization of this beautiful building. I might say that Pastor Jim is a forerunner and always available each time I've ever had any requests. He's come through serving the community. These are challenging times, and I agree with the supervisor that we have individuals coming from all over the city and the county lending assistance. Just today, I was driving up Cutting Boulevard, and there was a group at John F. Kennedy High School giving out food. And people are very generous and they're pouring their hearts out and assisting their neighbors and everyone else. And then finally, I want to acknowledge the tremendous leadership of our governor. As a small city like Richmond, we don't have the capacity to call press conferences and get on the television and articulate what is going on here. But Governor Newsom and to some degree Mayor Breed have brought forth information to the total state, and especially the Bay Area, as it relates to keeping us informed of exactly what is going on. And I also want to acknowledge the county has done that, but they don't get the news media. If you're not a big-time city, big-time county, you're not going to be able to communicate. Well, most people get their news through the news media, and especially television. And again, he's shown remarkable leadership, keeping us informed of what's going on in Contra Costa County, Alameda, San Francisco, and the other Bay Area counties. And just another echo of applaud to him and his leadership. So we will continue to do what we can at the Richmond level. We don't have the financial resources as many of the others, state and county, but we're here to serve our community to the best of our ability. And thank you again, Bob, for your leadership in this forum. You've done an outstanding job, and I think the community and all of us appreciate it.
Thank you so much for your leadership and your words of encouragement. Vice Mayor Nat Bates, thank you. Deputy City Manager Shasa Curl.
Thank you. In closing, I want to just take this opportunity to thank the West Contra Costa Unified School District for their leadership and work with community-based organizations and parents, students and staff there on food distribution. They have done an amazing job leading that effort, and they've been amazing, phenomenal partners. Also wanted to thank parents, teachers, for all of you that are involved with distance learning. You, like myself, it's been certainly a challenge, and so I thank you all for being part of this challenge with me, because I know certainly firsthand that it's been very difficult. Also, our Emergency Operations Center staff, just by way of background, staff from all city departments are involved in our Emergency Operations Center. Our public safety, fire and police are really, there at the helm, and our emergency manager, Genevieve, has been phenomenal in helping ensure that we're extremely well organized, as well as undoubtedly the direction of our new city manager, Laura, has been really helpful. For those residents, if some of the resources that we've suggested today, if you're unable to find what you need, please also feel free to always call 211. That's pretty easy to remember, and it's always there to help. And we really look forward to continuing to work together collaboratively with Contra Costa Health Services, and thanking our health officer for being a collaborative partner in this work and always being available to us to help guide us in this really extremely difficult time. So thank you.
Thank you, Deputy City Manager Shasa Curl. And great advice, 211 is your friend for any resource in the county. And it has been a real testament to teachers and people getting out food in our communities. Police Chief Nisa French.
Good evening, everyone. So I just want to thank the Hilltop Community Church for giving us the platform to be able to communicate and interact with our community. I want to thank the community for your willingness to interact with us in a different but meaningful way. And I also want to thank all my staff because regardless of what's going on, they remain steady in their quest to provide service to this city. They come to work every day, they don their PPE so that they can stay safe and healthy, and they're continuing to provide service to our city. Last, I know a lot of people during this time want to know what they could do to help. A lot of people are at home, they don't, but they want to help in some way, and there's several ways that you can help. Donate to your local food banks. The food banks absolutely need food during this time. There are a lot of people that don't have resources to get basic necessities like food, so donate to your local food bank. I want people to focus. I know we get a lot of calls for service about people violating the health order, and we try to get to those calls as much as we can, but for your own peace of mind, focus on your sphere of influence. Who can you influence? Who's in your sphere that you can really talk about this health order and what it means and why we need to social distance, why we need to wear our masks, why we need to stay away from loved ones. I mean, we have another big holiday coming up, Mother's Day, and a lot of us won't be able to spend it with our mothers. It's a difficult time, but there's a reason why. And to just be able to explain that and explain it to your sphere of influence is helping us. And last but not least, I ask that everyone stay at home as much as possible, stay safe, and stay healthy. Thank you.
Thank you so much, Chief Nisa French, Richmond Police Department. And Richmond Fire Department, Chief Alan Sheppard.
That's the astronaut.
Adrian Sheppard, sorry.
I'll take it.
No, please, thank you, Adrian.
All right, well, thank you very much. Thank you for this beautiful room, and thank you for the pleasure of your time. I consider it an opportunity whenever we can get out and actually have an interaction with the community. I do want to extend my sincere appreciation to the many people who did step forward to confront these challenges of COVID-19. You've heard it said earlier, many people from across the city have come together as one inside an emergency operations center, and they have been led by one of the very best emergency managers that one can find, and that's Ms. Genevieve Cohen. And so great kudos to her. I also want to acknowledge Police Chief Nisa French and her staff. The police have just been incredible. Michelle Milan has been out there just interacting with the community, making sure that she's been a good messenger, both getting information to the people and getting information back to us. I just think it's been incredible. And to the people of my workforce, the firefighters, first and foremost, my command staff has been exceptional. These people have been working not only the regular shifts, but they've been going home and they've been working on projects, writing stuff on their own off time, going from store to store to buy equipment, to make sure that we have proper sanitizers for the fire station, so on and so forth. They've just been exceptional. I would think that on their off days, they're probably putting in a good 8 to 10 hours of their own personal time to make sure that we confront this challenge. So, and that's not unique. I'm just recognizing them. That can be said about many other people throughout the city. So just thank you to everyone, but lastly, thank you to you, the community. I know Edie chimed in earlier, and she's always there to help, and so many other people inside the Richmond community have stepped forward to help us, so thank you so very much.
Wonderful. Thank you again, Chief Sheppard, and thanks to all our leaders who participated in this town hall tonight. Most of all, thanks to the Fairmede Hilltop Neighborhood Council and Hilltop Community Church for hosting this wonderful event. And actually, I should say, most of all, thanks to you, the community, for watching this. Please share the video with your friends and neighbors. Embody what Chief French said about try to talk to your sphere and your circle. We can all be healthier and we can all be safer if we all practice basic social distancing and mask wearing and other precautions. Contra Costa County has been a leader, and let's continue to be so. Thank you very much, and we're signing off.